Sweet syndrome. Sweet syndrome is rare condition. Its main signs include fever and painful sensation that appear most under hardness, hair, and throat. The essential cause of Sweet syndrome is not. In some people, the trigger is an infection, relying on certain medicaments.
Sweet. It can actually cause painful skin lesions as well as fever, and the exact cause known. It can be triggered by anything from an infection, an illness, medications.
People who get this, but it goes alongside other major systemic illnesses, oftentimes like autoimmune conditions, inflammatory bowel disease. Sometimes it can actually be the sign of an underlying leukemia or lymphoma, but sometimes we don't know why it happens.
Now,
we think it's more of a reaction.
With something like this, it's not necessarily an easy diagnosis either. It's not like you see it and say, oh, you know what, another case of Sweet syndrome here.
The history, they're very painful. People often have fevers. If you see these red, juicy, almost target-like spots, they're often on joints, hands, feet. You can see arms here. And the main thing, actually pretty quickly, the patients are sick. And in fact, when I used to see patients in the hospital with this, they were febrile, they had a high fever, they were really uncomfortable. And then the diagnosis is often just made on biopsy because it's the type of cell you see. But fortunately,
Application in the nerve if for Sweet syndrome is corticosteroid pills such as prednisone. Signs and symptoms of despair wither on 30 days after starting therapy, but they also repeat. They may seen on Sweet syndrome in small rest wounds on the arm, neck, or hair and throat.
Sherry is a client of ours here at P2 Personal Training. She was just diagnosed with Sweets, an autoimmune disorder. Yes, Sweets is SWETS. Sounds crazy, right? But Sherry's going to really quickly explain to you a little bit about her autoimmune disorder.
The fact of the matter is that if you can get your blood flowing and get more oxygen to injured areas of your body, including your skin, that you will heal a lot faster. And that's what the bungee did for me, and what Patty did as far as an exercise that could get that blood flow going as fast as possible. Being that I had a hip surgery 8 weeks ago and don't have the movement yet to actually exercise hard, she did it the right way. And when we were done, I had veins popping out of my legs and my arms, and that blood was flowing, and I felt good. And I know that's what's going to help me at least battle the symptoms. To find out what causes it is a mystery.
We're excited. So we're going to show you some movements that she's done, and we're going to get her feet and her legs. We're going to get it on film so you can kind of see the blood flowing through and watch her vascular system go to work. This is going to be exciting. Yeah. But we're going to kind of show you what it looks like.
Pros and cons. Sit in general, women are more likely that means to have Sweet syndrome. It will not hold adult and even baby can develop Sweet syndrome. This is in private affecting people with the age of 30 and 60. Pregnancy. Some women develop Sweet syndrome during pregnancy by sensitive. In Suez in Ecuador, Sweet syndrome aims for occur fairly neutrophil dermatosis is characterized by a constellation as clinical symptom, Physical, fluid, and pathology findings will include fever, neutrophil, tender insult, circulation, popular knowledge and plate, and diffusion strategy consisting predominantly of mature neutrophil. These are typical locations in the upper dermis. Conclusion: Get a diverse association and manifestation and sweet syndrome. It should avoid the bit considered as different. Diagnostic in patients with colic, febrile injury, and skin right, and timing diagnostic hours physical to Beijing appropriate treating as well on the ability to manage your own injury cause. Thank you.